very important session on how to stay safe and healthy during the COVID-19 pandemic. My name is Norma Garcia, and I am the Director of Policy and Advocacy at Mission Economic Development Agency, also known as MEDA, in San Francisco's Mission District. And just a few blocks away from our offices, we are very blessed to have major institutions, healthcare and experts nearby as our neighbors. And one of those is the University of California, San Francisco Latino Center of Excellence. Today we have with us 4 doctors from the Latino Center of Excellence at UCSF who are going to give us information on how we can remain safe and healthy, and they're going to answer our questions. So we'll invite you to please stay tuned to hear these presentations. Before we get into that and the introductions, I want to say a couple of things. One is we want you to make sure that you count yourself in the census. It happens every 10 years. There are 9 questions and it takes only 10 minutes to complete. And now more than ever, we need to make sure that everyone is counted, particularly as we try to recover from the economic downturn of COVID-19. It's really important. The other thing I want to ask you to do is to opt in to receive text messages from MEDA. We don't send a lot of them, but we do send very important text messages. It could be alerts about what's happening with COVID-19, information about how you might be able to get housing, how you might be able to get help for your small business, and many more things. So please opt in to receive text messages from MEDA, and you can see at the bottom of the screen how you can do that. It's very, very easy. And so now I want to introduce our distinguished panel of doctors. They're just really marvelous. I was looking at these bios and thinking, not only are these health experts, but they're also people who are very involved in their profession and in making sure that there is Latino representation in the profession and that the Latino community is well served. So with us, we have Dr. Manuel, who is a family medicine physician. He's an assistant professor at the UCSF Department of Family and Community Medicine. He's also the vice chair for diversity at UCSF's Department of Family and Community Medicine. And he's the medical director and faculty advisor for the student-run Clínica Martín Baró. I also want to introduce our other experts. We have Dr. Marlene, who is the hospital medicine and addiction team director. She is the co-chair of the Care Transitions Task Force and of the Division of Hospital Medicine at UCSF. Also with us is Dr. Will Martinez, who is a clinical psychologist. He's an assistant professor in the Department of Psychiatry at UCSF. He's the director of Child and Adolescent Services at Zuckerberg San Francisco Hospital. And he co-chairs the UCSF Health and Human Rights Initiative. And last but not least, we have with us Dr. Amy Beck. Dr. Beck is a pediatrician, and she's an assistant professor of pediatrics and in the Division of General Pediatrics. So welcome all of you, and thank you so much for being with us to have this Facebook Live event to get important information to our communities. So if we can start, I'd like to invite Dr. Manuel Tapia to present vital information to us, general information about how we can stay safe and healthy. Dr. Tapia, are you ready to go?
Yeah, absolutely. Thank you so much, Norma, for the intro. And thank you for all the community to, to be able to take some time to connect, to have this important dialogue is super important for the patients we're caring for and the community at large. So I know the Q&A session is going to be really rich, so I want to just dive right in. If we can advance the slide. I'm going to provide an overview, a little bit of kind of interval data since the last time we did a webinar about a week ago, so we can go into the first informational slide. It's a bit of a rich slide, but I want to point your attention towards the graph on the left-hand side. As you can see, over a week's time, we've had a significant increase in the total number of cases, but that's something that we have expected. Testing has become readily available. So, there is some cautious optimism in the fact that even though the total cases are going up, which you can see by the solid line, the bar graph represents total deaths, and that number has only changed from 7 to 9, which is a relatively stable kind of approach. And when you think about we're diagnosing more people with COVID positive, but we're kind of keeping an eye out for what are some of the bad outcomes. And I know Dr. Martin will talk about this more in the hospital, but just as an overall overview, gives us some course for some cautious optimism. A couple other demographic things that I think are important about this slide is the purple bars represent the age groups. And interestingly, there's a lot of narrative about protecting kind of vulnerable folks, particularly in the later decades of life. But you can see when we look at San Francisco data, the largest bars are 19 to 30-year-olds and 31 to 40-year-olds. So this is really, affecting various folks stratifying across different age groups. And then lastly on this slide, the transmission category in the bottom right-hand corner, 70% of the positive COVIDs in the city are being transmitted via community contact. So when this first started emerging, we were asking a lot of people about international travel and that type of history. That's really gone by the wayside because we know that this is now prevalent in our community and it's circulating. We can go to the next slide. This is essentially a clear picture that Latinos are a little bit overrepresented when it comes to COVID positive. And this was an observation that was alluded to at our last webinar, but here we're having some data that really supports that observation early on by my colleagues, Dr. Martin and Dr. Fernandez. 18% of all the COVID positives that we have in the city are Latinx self-identified, whereas when you compare that to the general population, it's 16%. So it's an overrepresentation clearly there. You can go to the next slide. Great. So yeah, I mean, again, more data to kind of confirm this initial observation, but we still need more comprehensive data that can really help us do targeted testing in our communities. What we've seen so far, and this was mentioned before, is a predominance of kind of first-generation immigrant, Latinx, monolingual Spanish-speaking patients being diagnosed as positive in a very disproportionate way. So this is kind of telling us where, some of our targeted outreach needs to be. And one of the early observation or hypothesis was thinking about, well, maybe it's, clusters of families and things like that, but we just haven't seen that borne out in the data thus far. And it really tends to be distributed in a way that's not so easily traceable and kind of suggests that it's kind of circulating throughout the community in various different ways. We can go to the next slide. This is just a quick if you want to follow the numbers on social media kind of on a day-to-day basis, Bob Wachter is chair in internal medicine, and he every evening puts out a San Francisco update that follows things like cases, diagnoses, and mortality rates. Next slide. So, I think this is a whole nother kind of lecture that we can all sit in, but I think it's becoming really clear, and on the national scale, we're having more dialogue about the twin epidemics. We're not only dealing with a respiratory viral illness that's really affecting lots of communities, but we're also dealing with the health inequities that we've known have been here, but are accentuated during this time and really affecting our communities of color in particular. And again, it's happening across the nation, but thinking about like what the scenarios are here in San Francisco and how it's nuanced, I think some things are interesting to think about. Things that I've had in contact with patients is there's some folks that are essential workers right now. They're working low wage. They have to kind of maintain paying the rent or, putting food on the table. They're kind of forced to use public transportation. And they may be a sector of the workforce that doesn't get, priority around protective equipment, training on how to stay safe at work. So all these are opportunities for more transmission out in the community. The other side of the coin is folks who are facing job freezes. And from a more kind of survival sense, because of the intersections around housing insecurity and, food insecurity and things like this, we're seeing that folks are kind of forced to engage in long food bank lines or shelters and other areas where it could be really contributing to this transmission. And then on top of that, of course, there's the institutional fears around, getting stuck with a big bill or how this is going to affect immigration status. Next page. So really the main message is, how do we respond? And right now, the main message I want to communicate from the healthcare system in San Francisco is that we need folks to call either 311 or their doctor so that we can talk through whether they are meeting criteria for testing. If you have symptoms, please do not think that you are not eligible or you can't afford testing. We have kind of worked this out, and things are very different from what they were even 2 weeks ago. So if you have questions or you have symptoms, please call your doctor and keep calling them until they call you back and some healthcare professional triages you and figures out whether it's appropriate to get a test or not. And for folks who aren't insured, don't have a doctor, don't have a medical record number, if they're a San Francisco resident, we want to reassure them that they could still call 311 and essentially say, I would like a Spanish speaking operator. I want to be transferred to a line directed for folks who have no insurance. Those are kind of the key kind of messages folks should be identifying themselves as. And there is directed scripts for nurses to triage them. And if they need testing based on our medical criteria, we can get those at different sites across the city. And it's really important just to point out, like, going to the urgent care site as a walk-in right now is kind of it needs to be considered carefully. Some people need to go to urgent care because they're feeling really sick really fast, and that's important to have that access. But some people just want to know, should I be tested? I'm having mild symptoms. And it's important for us to think about the folks who don't have insurance to be able to have a phone resource. So I'm happy to share that that is something we should be utilizing. I'm going to speed through the next stuff because I think we've covered, but we can go to the next slide here. So I've kind of covered why testing. We could skip through that. I think the one point I'll mention, as we know more and more people who are positive, it does help us become more creative in our follow-up, monitoring their symptoms, calling them when we know they're positive, because we want to monitor their symptoms more closely, but also in terms of isolation. We can also put people in, DPH has made, the Department of Public Health has made rooms available. So if someone's positive in a household where everyone else is not sick yet, there is options to get them isolation to make sure their family is safe. The next two slides, I think we can kind of speed through. I'm sorry, I'm just trying to emphasize certain points. And then the next slide is okay to go. Yeah. So essentially, I'm going to summarize the past two slides here. When we think about all the folks who are positive with COVID, roughly about 4 of every 5 is able to kind of manage their symptoms with supportive care and hydration at home, and really being in communication with their healthcare provider. The other 20%, as you see here in the bar graph, 15 and 5% reflect 15% reflect folks who are having enough respiratory symptoms that they need some support and they're admitted to the hospital, and 5% who are ending up in the ICU. So as a review, the 4 cardinal symptoms that we're talking about here are fever, cough, shortness of breath, and body aches. There are some atypical symptoms to be aware of, like headache, sore throat, and runny nose, but mainly by and large, we're seeing the 4 cardinal symptoms as really being the predominant ones. Go to the next slide. Sorry, I've got a lot of slides. So when we think about who's vulnerable, this is, again, a review. It's folks in the later stages of life, folks with suppressed immune systems, and folks with chronic diseases. And not to be forgotten, folks who are actively smoking are shown to have worse outcomes with COVID. All right, next. You've all seen this. One person can make a huge difference from us sheltering in place. So we can go to the next slide. So these are the last message. I'll wrap it up. And I just want to say thank you to all the community. This is a really big effort for us to be staying at home and making these sacrifices. And, I think we're pretty optimistic that we're making a difference. So thanks for your time.
Dr. Tapia, thank you so much for that information. I'm sure you have helped people tremendously. And I think part of it is, with the lack of information, it's your imagination can run wild, about what is possible. And what I think I heard you say very clearly is that people can get treated, that there is treatment available, that insurance is not a barrier. But I have a specific question for you, and that is, when should someone call 311? Is there protocol for that?
I think so. I just want to addend. So what we do have is testing for all folks. So the treatment is a little bit more plus or minus, and that's just going to depend
Mhm.
on how a clinician screens your symptoms and figuring out what the appropriate treatment is. So testing is widely available, and there's some innovative ways where the city has set up 3 testing sites where it's not set up like a clinic. You just go in, you have an appointment time, and you get a swab, and you get back home safely. Is the idea, and those are at Castro Mission area on 17th and Pond. The other one's at Southeast in the Bayview, and then the other one's at base at San Francisco General. But calling 311 is really important. I would advocate even, I mean, if someone's feeling symptoms and they're just not sure and they want to talk it through with someone, they should be calling 311. Um, I just think this is not the time to, take any chances per se. But if folks
Mhm.
are feeling well and not feeling any symptoms, then of course there's no need to reach out at that time. But 311 would be a time where, if you're interested in, if you think you may be someone who needs testing or you're worried because you have symptoms and you live with someone who's high risk, those are
Mhm.
situations where we want to encourage folks to reach out.
Thank you so much. I'm also wondering, so the treatment is kind of, is that something that the doctor must order? It's not, if you get tested, you don't automatically get treated. You get tested if your doctor orders it. Is that also a requirement?
So yes, you will. I guess I should be careful about my words. You will receive treatment, but there's no true proven treatment for COVID right now. So I know there's a lot in the news right now about promising maybe studies or mixed evidence around studies and
Mhm.
things like this. But essentially, if anything COVID related would trigger either your doctor or a doctor who you've never met to call in prescriptions to the pharmacy, for example, or give you guidance on how to manage this at home, then that would, you would be eligible for that. If they were concerned enough that they had you come into the hospital, then that opens up a whole nother window of treatment that you would be eligible for.
Wonderful. Well, thank you so much. That's very, very helpful to know where those degrees of
Yeah.
assistance are. And so I'm sure that we're going to have some questions for you after this, Dr. Tapia, but I think we're going to move on to our next
Yeah.
doctor from the Latino Center of Excellence, and that would be Dr. Marlene Martin. And there she is. Welcome, Dr. Martin.
Thank you so much for having us.
Yeah.
Great. Next slide. Next slide. So hi, everyone. I am a hospitalist. I'm trained in internal medicine, and that means that when somebody goes to the hospital, to the emergency room, and they need to stay in the hospital because they need hospital care, I take care of them while they're there. And I am really grateful to you for learning, because many of the patients that I am taking care of right now are members of the Latinx community who have COVID. That's predominantly who I'm taking care of in the hospital, and so I think this is a wonderful opportunity to do some education. Next slide. Okay. So we reviewed some of the symptoms in the last talk, but just the most common symptoms really that you get from COVID are a fever, cough, and shortness of breath. And then after that, it is a viral illness, so you can have the same symptoms that you get with any other virus: fatigues, headaches, muscle aches, sore throat, chills, sweats, and dizziness. And there are some less common symptoms, including some gastrointestinal symptoms like stomach ache, nausea, and vomiting and diarrhea. And then other neurological symptoms like loss of smell and loss of taste. So, there's a whole spectrum of different people who are infected with COVID. And this, you have, I made different colors for the people on this slide. And all of these patients have COVID. And what we see is that about 20% of people are asymptomatic, meaning they have no symptoms. They may have the disease, they are carrying the virus, and they are probably actually infecting other people, and they just don't know it. And I think that is why this disease is so hard to control, and why it's been spreading the way that it has. And then we have other people, 6 people who have common symptoms. They have the fever, they have cough, they have a sore throat. They're able to take, Tylenol at home and eat healthy and get some rest, and they recover and they do well. So that's 80% of the people. And then in the hospital, we're really seeing about 20% of patients, and most of them come because I'll explain a little bit more on the next slide, but it's about really 20% of the people that we're seeing in the hospital. So the people who are coming to the hospital are those who have a severe shortness of breath and chest pain, and they are needing respiratory support. They need oxygen often, and this is because they have a pneumonia, and this means that the infection has infected their lungs and caused some damage, some damage to the tissue in the lungs, and it's in both lungs, which is sort of not as common as other pneumonias that we see. So what do we do for people who come to the hospital? What we're doing is we monitor their respiratory status. So a lot of people start to breathe faster. They're breathing in double and triple the rates that we see as normal. And then we also provide oxygen to people, because sometimes if the lungs get injured, then the blood doesn't get enough oxygen. And so people feel very short of breath and they feel very tired, and it's not safe for them to be home without oxygen. And so these are the people who need hospitalization. And again, that's about 20% of the patients. And then we also provide supportive medications. And there is no clear treatment for COVID-19. It's really support with medications to help with symptoms, whether it's pain, headache, body aches, it's cough medications. There's some experimental treatments, some studies that are happening, and it's really too early to know which of these work and which of these don't. And so that's why we have to be so careful about where we're getting our news from, and trust the experts. And so if somebody that is going to, the last slide, please. So if somebody that is going to the hospital, what is important for them to know? I think that it's really hard for us to predict who is going to get severe illness. And so it's important to know that some people can get very sick and may need help breathing. And so it's good for family members to know what that person's, if that person's okay with getting an intubation, which means they need a ventilation support to help them breathe, that they know what your preferences are in case you're not able to make decisions. So it's just good for people, regardless, apart from COVID, to have family members or friends who know what your wishes are. So most people, I do want to say, recover from COVID, but the people who are at highest risk of complications, again, a lot of people, it's hard to predict, but the things that we do know are that people who are older, people who have some lung disease or heart disease, who have diabetes or cancer or obesity. And these are often the patients who have one or more of these factors who are getting hospitalized. But to be frank, the people that I'm taking care of, that I'm seeing at where I work, are young, a lot of young men, 30 to 40, 50, who don't have a lot of these risk factors and are being hospitalized. And so, I know this has changed progressively over the last couple of weeks, but last week we heard from the CDC, and before that we heard in the bottom right from the LA mayor that, you know, we should wear a mask in public, and really we really should wear a mask in public. And I don't mean the N95 masks that, you know, are for healthcare workers who are caring for people with COVID in the hospital to use and to protect themselves, or for the people who are, you know, making our hospitals run, who are cleaning the areas so that we can keep everyone safe. What I mean is these masks that you can make at home, these simple surgical masks, and next slide, please. And if you don't have access to these masks, then just you can use a scarf, and just make sure that you're washing it. It's really about getting that that blockage, so that if you're infected, you don't infect other people, and so that you're not touching your face. That's really the point of the mask. So you really can protect yourself, and this is why it's so important to maintain physical distance from others and 6 feet apart, even if that means crossing the street so that you're far away from someone. And I know a lot of people, you know, are trying to get exercise, and there's people riding their bikes on the street, and so like, just if they're not moving, just, you know, do yourself and do them a favor and move. And then this is why it's also very, very important to, you know, you're safer at home, shelter in place, that if this is possible for you to maintain it. And I know that it's just so hard financially for a lot of people. And so if you can't maintain shelter in place and you have to go to work and you're an essential worker, then making sure that you're wearing that mask when you leave the house, so that you're washing your hands regularly, 20 seconds, that you're not touching your face, sort of how these different graphics show. And I believe that is it for me.
Dr. Martin, thank you so much. That is such helpful information. And it seems like every week we get new information that we can use to try to keep ourselves safe and healthy and keep others safe and healthy. I made a mask, and it is possible to make these. There are all kinds of patterns available online where you can make them. And once you get started, it gets kind of easy. So if you don't have access to masks, consider looking online for a pattern and make one of your own, and make one for family members as well. But bandanas work. I mean, it's just about making sure that your face is covered, right, when you go out in public, as much for what you breathe in as what you breathe out, right? Mm-hmm. Yeah, thank you so much. I'm just wondering, for part of what we're seeing is it's still difficult for people to maintain social distance, and I'm wondering if you can comment on how important that is, despite the awkwardness, because there's a cultural element to this as well. I mean, it feels very odd for me to stay far away from people and not hug people when I see them. And I know other people are feeling this way too. So can you talk about that?
Yeah, you know, I hear you. I love hugging people. It's you know, it's in my culture, it's in our culture. And it is hard, but also I think of it this way. I think of it as like 20% of the people don't even know they have this illness. If you have this illness and you infect somebody else, you could be responsible for somebody ending up really sick or even dying, right? And not knowing it. And so this is why it's so important to maintain that physical distance and finding other ways that you can saludar, you know, you can, I think there's videos online of people like using their toes to like do like handshakes basically, or dancing, right. And finding other ways to connect.
Yeah, that's very helpful. That's very helpful. And it is a little out of our human nature to be so distanced. But I think your point is well taken. This is about like making sure that people stay healthy.
And I think the other point is that the more we do this, the sooner shelter in place will be lifted. So like if we're all in this, like this disease, we're all connected to each other. It's really affecting Latinos. And if we want to go back to normalcy, we have to get rid of it everywhere. And that's, you know, especially among our community.
Yeah, no, that's absolutely right. You know, we have a question here from Jonathan. And Jonathan says, hello, everyone. I have a 3-year-old son and a 4-month-old daughter. What are you seeing in terms of risk, symptoms, and hospitalizations for young children?
I know Amy is talking next for in terms of pediatrics, so I'll let her take that question. But I do want to say that this disease is primarily affecting adults. Thankfully,
thank you very much.
Not thankfully, but I'm glad that our children are safe.
Wonderful. Thank you so much, Dr. Martin. And next we have Dr. Amy Beck is going to join us. And Dr. Beck is a pediatrician. She's assistant professor of pediatrics. I think, Jonathan, she's going to answer your question, but she has a presentation first. So, Dr. Beck, the floor is yours.
Hi, everyone. Thank you so much. There we go. Okay, next slide. It's a great pleasure to be here. So I'm sure that many, great. Next slide, please. I'm sure many parents out there are asking themselves this question. And as a parent myself, obviously it's the biggest thing on my mind. So how does COVID-19 affect children? Fortunately, for the vast majority of children, the symptoms of this illness are very mild, and the vast majority will be able to be managed at home. We do know that in children, the most common symptoms are fever, cough, and sore throat. Some less common symptoms, but that we are seeing include vomiting, diarrhea, runny nose, and fatigue. Next slide, please. So how can parents protect children from COVID-19? So children should stay home if at all possible, and we certainly want them to avoid public settings such as stores and laundromats. It is okay for children to go out for a walk or a run each day if you can find a place where the child can be outside walking or running and is still able to maintain 6 feet of distance from others around them. Children should wash hands often, and parents really need to assist and supervise. Particularly younger kids are not very good at doing a really good job with hand washing. If anyone has any sort of symptoms of, cough, cold, anything in the house, no one should share utensils, plates, cups, towels, or bed linens with that person. And we also just recommend wiping down surfaces that are frequently touched with a disinfectant cleaner at least once per day. And then in terms of the masking question, masking is really more to protect other people from us because we may have the virus and not know it. At the same time, there is probably some degree of protection if you are wearing a mask. And so if you are able to make a cloth mask for your child and they are willing to wear it, I would absolutely recommend it. But it can be difficult for younger children. So I wouldn't think that that's a mandatory thing for them to be outside. I think the most important thing is the physical distancing and social distancing from others and the hand washing. Okay, next slide. So what should parents do if a child has symptoms? And we really recommend calling their child's doctor or medical provider for advice. And doctors are going to take into account a number of different factors when deciding if a child should stay at home or if they should come in. And these factors include their age, their vaccination status, how long they've been sick, the types of symptoms, and then any underlying illnesses that the child has. Just like in adults, if the child has an illness that is suppressing their immune system, they are higher risk. The majority of children are going to be cared for at home, and that's going to be safe, but every situation is different. So I think it's really important to be in touch with your child's doctor. Okay, next slide. So how can parents talk to young children about this illness? I think we want to use calm and reassuring language. We want to be truthful with children, but we want to let children lead the discussion. So we really only need to answer what they ask. Some young children might not have a lot of questions and they might have 1 or 2 questions. So we don't need to bring up things if they're not curious about that. I would very seriously restrict access to news on the television and the internet for young children because it's frightening to them. It can be traumatic and kind of hard for them to interpret. And then we can empower children to care for themselves and the community by washing their hands, staying home, getting enough sleep, eating healthy food, and staying in contact with friends and family with phone calls and video chatting. Giving kids a role in the process can make them feel better about all of the restrictions. Okay. Next slide. Oh, and this is, there we go. This is just a nice resource that I like. It's a coloring book that you can download that is very appropriate for young children in like the 3 to 7 range. It asks if they've heard about the coronavirus. It asks them to identify an emotion, to draw how they feel when they hear it. And I think it's nice because it gives them an opportunity to express what they're feeling. Next slide. More of this coloring book, and next slide. I like this. It says it's normal to worry, but the adults who take care of you will keep you safe, which I think is just the most important message that we want to keep reiterating to children. Next slide. So how can parents help children to cope with being out of school? This is extremely stressful time for parents, and particularly parents of young children. If at all possible, we do recommend establishing a daily schedule of activities, writing it down. For young kids, actually maybe using some pictures so they can identify the different components of the day to try to mimic the feeling of being in school. You want to include some breaks for movement, whether it's dancing, a walk outside. There are a lot of YouTube exercise videos for kids that can be fun. It is also important to try to include some time to be together as a family without distractions from television or phones so that you can really check in with your kids. And then, as we mentioned before, really trying to schedule regular phone calls or video chats with friends and family members to help with the loneliness of this time. Next slide. Oh, and how should parents respond to behavioral changes? I think it's important to recognize that behavioral changes are common when children feel anxious. And young children are often not able to put those feelings into words. And so instead, they will behave differently. So parents may see more tantrums. They may be more clingy than usual. They may appear distracted. Some children may have difficulty sleeping. Ways that parents can support children is by responding calmly and patiently. The child is not intending to misbehave. They are probably just manifesting the stress and anxiety that so many of us are feeling. You want to provide reassurance, lots and lots of affection, as many hugs as possible, and then establishing the daily routine and sticking to it can also be very helpful. Thank you. Happy to take any questions.
Thank you, Dr. Amy Beck. That's really great advice for parents who are anxious about how to take care of our children. One thing that has come up a lot is the question about from mothers who are pregnant, how they, whether or not there's any risk of transmission if they are COVID-19 positive. Do you have any thoughts about that?
Of transmission to infants. So I think it's very early to say. There have been definitely some cases where newborns have tested positive. And my understanding is that it's not clear whether the virus was actually transmitted during the pregnancy or just after, the baby delivered. Fortunately, at least from everything that I'm aware, those infants who have tested positive have done extremely well. So that is the silver lining in all of this. But I think that we don't know yet whether there is transmission actually during pregnancy.
Got it. Okay, well, that's another thing that we're yet to find out. There are so many mysteries with this illness, and but you've helped to answer lots of questions that a lot of parents have. So thank you for that. And I wanted to say, it looks like somebody's asking a question here. So what about for children with disabilities? Any advice for them in terms of change in their routine? And for children with disabilities, routine is very important. It's important for all children, but especially for children with disabilities. What would you say about
Yeah,
that?
yeah. So I think that's an extremely important question. And I would just like to say that for parents of all children, in particular children with disabilities, the obligations for special education do not go away because of children needing to be at home. So schools are still expected to offer education to your children and to make accommodations for their disabilities. And so if you have not heard, if you have a child with a disability who is enrolled in a public school and you have not heard from the school, the teacher, the principal, I would advise parents to be reaching out and calling. Teachers are, still working, and they should be able to provide support and guidance and information for parents about what the classroom's routines were and how they can adapt some of this to the home. But I think, yeah, we all need to recognize just how incredibly stressful this is, in particularly for children with significant disabilities.
Yes, thank you very much. So yeah, I'm very aware with those routines that are needed for children with disabilities. And I like your advice about making sure you contact the school or the school district to make sure that you're getting the support you need for your child during this time. Looks like we have one more question here.
Yes.
Okay, so one more question. This is from Jonathan. He says, if we have to take our kids out of the house, that is, for example, upcoming medical checkups or going to the market, should we be putting masks on them or covering them up? I think you answered that. So basically, how should we protect children if we have to venture out with them?
Yeah, I would say if it's at all possible to avoid store or laundromat. I realize, of course, there are parents who are single parents and they don't have other supports, and they still need to buy food and they still need to get their clothes washed. So certainly in those cases, children may need to come with parents. But if there's any other option for children to stay at home, that's what we would recommend. And if you're going out, obviously, for an essential medical appointment, I think that if you have a cloth mask and the child is willing to wear it, putting it on them is certainly reasonable. And just being very conscious of any surfaces that they're touching. One of the biggest issues with young children in schools is that they just don't have very good boundaries in terms of personal hygiene, and they're often touching things without us even being aware. So.
Great advice. And I think one thing we can do as adults is sometimes kids can't keep their distance from people. They just kind of like go towards people, that maybe we as adults have an obligation to steer clear, even when kids are coming in our way. Yeah. Wonderful. Well, thank you so much. And we have one more presentation. Thank you very much, Dr. Amy Beck. We're going to have Dr. Will Martinez next. And we're very, very pleased to have you next because there's a lot you're going to talk about that deals with those questions of stress. And we know that many people who are feeling stressed right now are parents who have children at home with them and many others. So we're going to give you the floor, Dr. Martinez, and look forward to your presentation.
Great. Thank you. Thank you, Mela, for having me, and good afternoon, everyone. I'll get right to it and talk about, one of the major topics we're hearing here in our clinic is a lot of parents being worried about, being stuck at home and having all these things that they're now having to take care of. And Dr. Beck talked about a few things, but I did want to be clear and kind of accentuate about ways to manage the stress. So one, staying active, whether that means going to walk safely around the neighborhood or whatnot, or doing exercises at home, online, doing them as a family, as making it a social event, will go a long way to helping manage stress and getting good sleep as well, which will be helpful for that. One good resource I just found out about today is the UCSF gym has all their classes online now. I believe they have them on YouTube, so you can watch these gym classes and follow along and whatnot at home, and they're all available for free. Maintaining rituals as much as possible with your family, trying to do things together, like having a dinner together, even if it's through a FaceTime or some other type of, live streaming. It's still a social event. Even though you're not physically there, you can still be social and try to do that. I also say, especially for parents, being able to have time that you schedule every day to be with your husband, your wife, or just to be alone, even if it's 15 minutes. A lot of parents, I know, folks may not have that kind of space to be alone where they're living. But one potential option is even just 15 minutes alone in the bathroom per se, and just getting that time to yourself would go a long way. I also want to be mindful about, folks who might be experiencing a lot of distress, having a lot of thoughts about feeling sad, being especially anxious, and wanting to reach out for more help. And I would say, one thing that people often bring up is that mental health treatment is for rich people, people who have resources. But I got to say, in San Francisco County, we have a lot of great mental health resources. For instance, for kids and families, on Medi-Cal, we have a lot of great clinics. We got Instituto Familiar, Southeast Mission Family Center, our own clinic, Child Adolescent Services at Zuckerberg, San Francisco General. All these clinics provide great services and treatment. Many are now still open. We providing everything either through phone or via video conferencing, and these services are still available. If you have private insurance, check with your private insurance, see who's covered. UCSF at Parnassus, the main campus, their Langley Porter Institute, has really great programs. They accept all types of private insurance, and there's many others, Kaiser and other providers around the city who will take your private insurance, but check with your providers around that. And then additionally, I wanted to share a resource that the psychiatry together, that's for the community, and for folks who are working within UCSF on how to manage stress and different resources for that. It has stuff about kids and families. There's lots of apps there, some of them at no cost, that you can use to help with managing stress and anxiety. And for folks who might need a little bit more, I want to share a few different resources as well. So the San Francisco Suicide Hotline is available 24 hours a day, 7 days a week. And that's a line you can call if you're having thoughts about feeling very sad or feeling you wanted to hurt yourself, or someone who that would benefit. Please call that line. It's available 24/7, as I said. Another to get further support is San Francisco County's Comprehensive Crisis Services line, and I'll share that number with you as well, that you can call, and that's available 24 hours a day, 7 days a week. And then finally, there's the San Francisco County's Access line, and this is a line where if you're looking for a mental health provider and having a hard time finding one, they're available there to kind of help you figure out which is the right place to go and help you get there. I can also share that. And then finally, I did want to bring, and this to go with Dr. Beck's talk about special education services. Starting April 13th, all those special ed services will begin. I am going to share San Francisco Unified's website as well, that they just put up in the few days. And there's a lot of resources there for parents working with kids with who are already classified in their special ed and have an individualized education plan or an IEP. You can go there, it has a lot of resources. You should be getting a letter that's telling you what the modified plan will be while the kids are home. So be on the lookout for that. The website explains more. And that's it for me. I'm looking forward for questions. Happy to speak more.
Dr. Will Martinez, thank you so much for that information and all those resources. We're going to add them to the banner at the bottom of the screen so that people can access that information. I was really impressed by what you said about how important it is to reach out to people. So distant family members who may be farther away, like maybe you can do some sort of video chat or FaceTime but maybe even picking up the phone too, right? Because some of the elders in particular don't have access to the kinds of video capability that young folks do. But it sounds like that's really great advice. And I was also really impressed by the number of resources that are available in San Francisco for everyone, and that's super important. And I'm also thinking that how important it is to integrate physical health with mental health. Like that's the whole person. And that we shouldn't feel ashamed or stigmatized in any way if we feel that we could use some extra support. Like we should just reach out and grab it and use that for our total health, for ourselves, for families, for our children. And I appreciate you bringing that together. Let me just ask a question here, and I think it has to go with the idea of the anxiety that is produced in the void of information. Like we don't know about the four corners of this disease. Tell us a little bit about what you're hearing from people and how you might be able to help someone who's feeling very anxious in this time of uncertainty.
Yeah, and some level of anxiety is going to be normal, during this time. So it is completely normal if folks are feeling a little bit stressed, anxious, uncertain about the future. In some ways, this is almost an existential crisis, right? About there's something we can't even see that's causing a lot of danger to us as a human race. I think for the most part, we got to maintain that we are doing all we can right now. Our social distancing, and especially California, we're seeing it's helping tremendously. We want to stay present. We want to stay with our loved ones and try to pay attention. Exercise is going to go a long way to help that. There's so many studies and all research out there about the importance of exercise and what we call behavioral activation, or staying just active, and what that does to our mental health, helps with depression, helps with anxiety, managing stress, etc. So all these things and managing and taking it day by day and just being in the present is going to help with kind of managing those feelings of anxiety and uncertainty.
That's really great. That's really great, because even in this sense, a feeling of being out of control, there are certain things we can control that could help us feel better, things that we could actually do ourselves.
Correct. Yep.
And I think we have some questions coming up. Thank you so much, Dr. Martinez. Oh, and we have Dr. Tapia back with us. Let's see who else shows up on our screen. Let's look at our questions. Let's see. Give me 1 second. So a really good question is, how do we protect our families if we're an essential worker? So we have to go out and provide an essential task out there in society, and we have to come home. How do we protect our families?
Very true.
It looks like
a lot of. Can you hear?
Okay. Yes, I can hear you. Go ahead, doctor.
This is a reality for a lot of people, right? Shelter in place is not an option. You can't stay home. You need to be able to go and make money so that you can pay your rent and put food on the table. And so those things that we said earlier, so wash your hands consistently, don't touch your face, wear a mask. When you try to maintain physical distance. When you're not maintaining physical distance, make sure your mask is on. When you get home, change, shower. That's really, I think, the bread and butter of what we can do to protect ourselves, the people around us, and our loved ones.
Okay, that's really great advice. Thank you very much. And I think that's a big question for a lot of people. So we have another question, and it is from Ariel. And Ariel says, today we were told on another UCSF webinar that about 1/3 of COVID-19 tests are false positives. They asked how to prevent spread if people aren't diagnosed accurately. And the question is, are false negatives also happening at those rates, or is it only with the test? So anyone like to take this question?
I could
The
take a
question of false
stab.
positives or false
I'm not,
negatives. Yeah, thank you.
yeah, I think, let me know. I'm having some audio if I'm echoing, but I think that ultimately the evaluation and the clinical judgment of doctors, we've seen a lot of cases where we're considering either false positives or false negatives, but the counseling remains the same. You had a severe viral illness, even though the test isn't showing us kind of what we're seeing in terms of the clinical behavior of the presentation. We are usually following through on the conservative side and almost treating it as if it was COVID in the case that, let's just say, we were suspicious of a false negative. False positive does become a little bit more tricky, right? Because then we might be kind of restraining in a conservative way, like telling people, hey, you got to isolate yourself from your family or move out, or some drastic measures that we're all trying to figure out. However, again, I think what I've seen in practice so far has been erring on the side of conservativeness, and knowing that because this is such a new entity, our lab data at this point isn't perfect, and we just kind of have to take the whole picture into account. And that's also knowing what the patient's home environment is, what their occupation is, and working with them to find the best individual course of action.
Thank you very much, Dr. Tapia. We have another somewhat related question. Someone is concerned that that's a really high number of false negatives, 30 to 40%. And the question is it virus itself going to giving a false negative, or the test itself? How reliable is this San Francisco curve that we are starting to see? And I think we're seeing that we're starting to kind of plateau. I'm not sure. Are we close to the peak? Are we headed towards the peak, or are we holding steady? What is your opinion?
That's a great question for our epidemiologist.
For this one, maybe you can help us out with this one.
Yeah, happy to. So this is a great question for our epidemiologist. Yes, the test has a false negative rate, and as Dr. Tapia explained, it does have some implications, and we're erring on the side of caution. They say that early on in the disease course, maybe the viral load is low, and you don't do the swab the right way. I think there's just so many reasons why it could be a false negative. I would just focus on doing the things that are recommended by the Department of Public Health, maintaining social distance, physical distance, shelter in place when possible, wearing a mask when you're around others, washing your hands, and then we're going to keep making that curve stay flat, and also taking care of the most vulnerable communities, because this is affecting, yes, a curve is bending, but it's affecting a lot of people, and it's affecting very vulnerable populations already. And so we all have to do our part to contribute. Sounds like the next question is, can the hospital deny services to anyone?
I froze up.
Yeah, that's a great question, and I think without going into major details, trying to explain a little bit about what we're experiencing. So, at the hospital, particularly in the emergency room, you cannot be denied services. That is a law that has been well established. What makes this, I think, pandemic uniquely tricky is that the message of, hey, go to the emergency room, they can't deny you services, there's a double edge there. We don't want folks going out of their, protective kind of isolated spaces unnecessarily, which is why we're really trying to emphasize the phone lines right now. And I think if I could editorialize, I think one thing I'm noticing as a primary care doctor is that we aren't as busy with inpatient visits these days because folks are staying home. And I don't know if there's data to support this, but I would say that there is capacity for your doctor and their team at your medical home to return your calls in an appropriate timeline. I know that last time we had a webinar, people were really worried about not getting calls back from their doctors and those types of issues which come up. But right now, things are being flagged if they're anything related to COVID or respiratory symptoms. And our teams are really working hard to respond, to walk people through the decision making around, do I need to go to the hospital and potentially expose myself to COVID, or if I have COVID, expose other folks at the hospital, including healthcare workers and other patients. So no, you cannot be denied services. And I think that's why a lot of the advocacy right now is around calling your medical home, getting an answer from them. And if that doesn't apply to you, you don't have an insurance or a doctor right now, that's where the 311 can be a really useful resource. I should add, there is no charge for anything related to COVID treatment.
Thank you very much.
I think the other thing I would like to add is that in the safety net, we take care of everyone. In San Francisco Department of Public Health, Zuckerberg, San Francisco General, San Francisco Health Network, the community-based organizations, we are here for everyone. If you need it.
Yeah. Yeah, I think this was mentioned at the last webinar.
Tremendously reassuring. It's tremendously reassuring for everyone to know that there will be healthcare for you if you need it. And I'd like to thank each and every one of you for being with us today, because I feel like you've helped us in such a tremendous way. And you know, this video will live on, and others will be able to get the benefit of your advice later on if they weren't able to join us live today. I think I see Dr. Martinez raising a finger. Yeah. You want to add, Dr. Martinez? And I'm going to give everyone a chance to make one last statement, and then we're going to wrap up. Dr. Martinez, Great. Go ahead.
Yeah, because Dr. Beck and me we were both trying to figure out who to say this, but I want to, for parents out there who are trying to enroll kids in kindergarten, right? The deadline is Friday, April 10th. You should have gotten your enrollment letters in the mail. They were mailed out, I believe, March 20th. Usually you get that letter, you go to the school that you're supposed to enroll your kid and do it in person. That's not happening now. You should have gotten that letter, should explain what you're supposed to do. If you didn't, I just posted a number for the Educational Placement Center that you can call that hotline and make sure you find out what the process is to make sure your kid's enrolled in kindergarten. We're a little bit worried that this is going to fall between the cracks with a lot of our families. So we're already hearing about it. We want to make sure the word gets out there.
Thank you so much for raising that. And parents and everyone else who cares about children enrolling, please take a look at the banner at the bottom of the video for that information, which we're going to place there. Thank you so much. Dr. Tapia, would you like to have a final statement before we close out today?
Sure. I think I mentioned this earlier, but I just want to thank everyone for their, cooperative contribution of staying home. We're all making a lot of big sacrifices. We're all being pulled in a lot of different directions. But like Marlene was saying, I think this is going to take a collective effort to really prolong any type of surge and make sure that our folks working hard in the hospital can handle this, coming in large volumes. So I think it's important to acknowledge that folks have really, for the most part, bought into shelter in place. And if you look at other places in the nation, I think that so far we've really braced ourselves and prepared ourselves in a good place. And hopefully, taking it day at a time, we could see how things evolve.
And same thing that I just wish everyone safety and
Thank
health.
You, Dr. Tapia. Yes, the Bay Area seems to be doing, leading in this. Great. I hope I'm not interrupting you, Dr. Martin. I want to say thank you on behalf of Meta to Dr. Amy Beck, Dr. Will Martinez, Dr. Manuel Tapia, and Dr. Marlene Martin from the UCSF Center, Latino Center of Excellence, for joining us today for this Facebook Live event. We're glad to be your neighbors. We hope we get to collaborate with you some more. And thank you again for being with us today. Couple little announcements, just to reiterate what I opened up with is make sure you count yourself in the census, and we're putting information at the bottom of how you can get yourself counted either online or by telephone. And also, we want to invite you once again to opt in to receive text messages from Mission Economic Development Agency, MEDA, in San Francisco, California. Thank you very much, everyone, and have a good evening, and be safe, and continue to follow the wonderful and important advice that our doctors shared with us today. Thank you very much.
Thank you.
Thank you.
Bye.